Thompson School District staff. I am Todd Piccone, Chief Operations Officer for the Thompson School District. Welcome back, and thanks for joining us tonight. So what I'd like to do first is talk a little bit about our partnership and process of how we develop a plan to come back to school in a safe manner for all students, staff, and community. What I will say is a partnership. So we work real close with Larimer County Department of Health, who also gets their guidance from CDPHE, Colorado Department of Public Health and Environment, and CDE and CDC. So it's not one entity that makes the decision or comes up with guidelines. It's really a collaboration of different entities working together. But our partnership with Larimer County has been great. They really helped us and guided us through this is what you need to do to make sure your students, your staff, and ultimately our entire community is safe. So within that partnership, they helped us develop the guidelines. And some of those guidelines are, one is contact tracing. So we're bringing back students into buildings. So what we need to do is we need to put them into cohorts to make sure that we know who's in the building where. So if a parent of a student were to come up positive with the case, we would know the risk to the other students and the teacher or the staff or the maintenance workers or custodians, because we know where that person or that student was within the building, that staff or student was within the building. So we can trace through the cohorts, through the different individual groups in the building, where that risk may have gone. And they've actually got a team dedicated to help us do that. So that's not something the district takes on themselves. That's really something we work with our partners, and they help us work through that. They're the professionals in this. They say, okay, here's our risk. And then they outline the risk for what that may be. So that's why when we talk about contact tracing and, what does it look like if any of these scenarios happen, that's where we rely on our health professionals to help guide us through what our risks are or are not. Sometimes we can have something happen that we think is at risk, but the right precautions were in place, and really the risk is pretty minimal. So that's really number one from the county. And when you look at CDE, CDPHE, and CDC, is contact trace and keep the students in cohorts together. The second thing is we've all heard about is mask wearing or face coverings. So what does that mean? Well, that means we're wearing masks 100% of the time in the buildings. To allow the proper protection for the staff and students, because we are bringing more kids in the classroom that don't allow the 6 feet, which is okay. Guidance was just released as of today that only 3 feet is actually recommended between desks. And that came out from CDE, CDPHE, our state leaders that helps us provide guidance. But the extra level of protection, because we're doing that, is masks. So we are going to require masks 100% of the time for all students and staff. Now, you can work with your building leadership and develop a plan for mask breaks. We encourage go outside, get fresh air, make sure people are truly separated with the proper social distance of 6 feet plus, and then take your mask off, get a break. But when you're in the building, it is masked 100% of the time. But we will make accommodations for those students who need it and can prove that the need is there. If proof that the need is there, that they cannot wear a mask due to a special condition. The other thing we're doing is really to make sure we are keeping everyone safe is disinfecting the buildings. So there's daily, there's nightly, there's a whole nother process now for disinfecting a building. So whether it's restrooms, before and after lunch, disinfecting, hand sanitizer, hand washing, all that plays a part in keeping us, when I say us, our students and our staff safe. Hand washing, for example, if we can teach kids to properly hand wash, that then takes any risk factor down. So all these different pieces that are in place, one individual piece isn't going to eliminate all the risk. But when you add all these pieces up, the accumulation of all those pieces then take that risk and bring it way down. So when you look at hand washing, you look at disinfecting, you look at cohorts, mask wearing, face shields. We'll provide face shields for those staff that want to wear them. So all those pieces put together, each one takes a chunk out of the risk and brings that down. The other thing I just want to touch on real quick is the difference between physical distancing and social distancing. So when we started the plan, social distancing is really what was used in the community. It's the 6 feet social distancing. What the county recognized real quick was it's not 6 feet. It's physical distancing to the greatest extent possible. So within your classroom, within the room you're working in, it's really creating a space between students that you're separating them to the greatest extent possible. I just want to reiterate that and share that again because there's a lot of questions about, well, social distancing is 6 feet. It is. But also within schools, the guidelines that are coming out is the physical distancing as to the greatest extent possible. So, I say that and I share this. Those are really just highlights of our plan. But what I want you to know is within that plan, please know and understand all the details of it. Because as I said, I hit on 3 or 4 here tonight, but there's, I don't know, probably a list of 36, 5 pages worth of safety pieces in the document. Know those, understand those. It's the combination of all those pieces added up that help eliminate risk. It's not one piece individually that really takes the risk away. So please know, understand, and let us help you if you do have questions. So I thank you. I welcome you back. It's an exciting time because we're back helping our students, our community. And so thank you. And please let me know if you need anything.